on a day that everybody's already got it in their schedule. The only
Okay.
problem is Jennifer's not gonna be there that day. So that kind of,
No, that's this
Flubs it.
upcoming board meeting
right,
Wednesday.
so that's why I'm kind of thinking if we do a special, it gives everybody, again, single agenda item, everybody can talk about that one thing and keep it straight.
Yeah,
So anyway, just thought I would,
would this be something we would be potentially trying to vote on? Potential
make some,
phases?
make some decisions around, like,
Okay.
let's actually, set a budget,
Yeah. For sure.
that kind of thing.
Okay. Good deal.
So they have a few thoughts, recommendations that we'll bring forward.
So did they have they had a meeting today then? Huh?
Yeah.
Okay.
Yeah, to kind of do a wrap up, catch up.
Yeah.
Okay, come on, fast.
We do a pledge in this meeting as well.
Usually not.
Okay.
But you can if you want, whatever. however you
No,
want
it's
to
all
do it.
good. I just,
Oh, yeah, yeah, usually with these, they try to, I guess, truncate it a little bit, but, whatever you're wanting to do, I'm definitely open to.
tell my life story.
Yeah, just don't make it a 4-hour meeting, we'll be fine.
Oh, you're not gonna like this agenda.
Welcome to VAST conference. Conference not today. If you are the host, we'll connect you to your call. You are the first attention. Your host is joining.
Public policy and governmental relations. Excuse me.
So Terry is joining us as a potted plant only today. So just know, I will remind you all, don't direct conversation to him and he will not direct conversation forward. So just letting everybody know. You good? We're good. And then we have a share. There you go. So many pieces.
So many pieces. Thank you so much for your patience. Let's see. Getting my.
And we're already recording?
Yes, recording.
Perfect. All right. Mr. Chairman, you may bring us to,
Okay.
I think it's time, right? Oh, we're a couple minutes early.
We're supposed to start right at the,
We could take a deep breath.
yeah, I was like, that's the start.
Yeah.
We practice some mindfulness.
I either need to have it or have some fun. One or the other.
Listen, you want to have wine, he wanted to come in drinking some scotch, and I said whatever's best for everyone's mental health.
That's what it's about.
And then I ate some brownies. Plain brownies that came from the grocery store that Raquel bought on last week.
For the meeting.
It's more than.
Oh, you people, really?
Got yourself there.
Yeah, I know, but as soon as I said brownies, I was like, oh, no, I didn't mean that kind of stuff. Technically legal, by the way.
Technically.
In California.
Yeah.
Not going over state lines.
Well, I guess we can,
You wanna go ahead and, you might as well.
let's go.
Okay,
We'll call this meeting to order.
excellent, and it is
5:29,
perfect.
January 25th. Can you do a roll call, please, Raquel?
Certainly. Director Stanison,
Here.
Director Leach,
Here.
thank you.
Are there any public comments that have been submitted or anybody online?
No, sir.
Okay, no public comments, so we'll move on to the next topic. Discussion items, public engagement. Shall we start with Teresa?
Oh, boy.
Welcome.
Okay, sure. Well, if you want to pull up my.
Did you
I
send it?
emailed it to you. I emailed it to you. Okay, well, I'll just go over it. You guys have kind of seen the format and I'm open to changing or other points that we want to talk about. We started off the year strong. We had 72 events on the schedule
Wow.
for January. And that's both private and open to the public. So some of the interesting things that we had in the month of January was we were able to support a local nonprofit, Good Dogs Canine Training. So we had the dogs there getting trained. So, and kind of a cool organization that helps really service dogs for an autistic individual. So the family had trained the dog and they came, and the family member who was gonna take the dog home got the training on the dog. Then there was a graduation ceremony that was
Nice.
open to the public, so a bunch of people came out
cool.
and that was really, really nice. Really fun. So then we have RX Ballroom starting the end of this month, and Encore loves us, and we have a 4th card game group. But part of the fun about that group is these used to be in people's homes, so the groups are like growing and growing. Obviously, not only is there a new game they want to play, but each of the groups are growing in number, and so it gives people a chance for this to come out of a home into a social environment, and they can grow they can have more people join, and there's other things happening at the wellness center, and so that I think is really a great support for their mental health and preventing isolation.
Do you want to explain what the Encore
Oh,
Club is?
yeah, I don't know if you guys are familiar with Encore, so it is a club, a very big popular club in Fallbrook that's an offshoot of Newcomers. So there's a club in Fallbrook. When you come, it's either the first 2 or 4 years that you live in Fallbrook, you can be a part of the social club called Newcomers. And they get to learn about the area and, activities and, make friends. Then if you really like it, then you graduate to Encore. And it's a social club, and they do different outings, a little bit of fundraising, but mostly it's about the social aspect of getting together. So they've had these card games meeting in people's homes, and now
Come to your
I think we
place.
may have to say no to any additional ones, but we actually set up a room. But they're gonna be like, this is the room with the card table, it's a card room at the wellness center. So that's good. We did a test kit giveaway, so in December, on December 22nd, and we had 20 people stop in on this, limited basis to pick up COVID at-home test kits. And that was done through email and Facebook, and we had 20 people stop by, so it was a pretty good response. So this month, I get to come in off of a high from being at our Wellness Wednesday event, which I think is pretty for the first one of the year, pretty successful. We have kind of like expanded some of the offering. So this is where we partner with the San Marcos School of Nursing and or Fallbrook Family Health Center to do free health screenings. As we have additional partners, we'll offer other screenings. Right now, the basic ones we will offer is blood glucose, blood pressure, and BMI. So those are standard. Last year we had someone that was able to provide hearing screenings. We're talking about head and neck and oral cancer screenings and some vision screenings and some other things as we get on into this year. But the core is those screenings. So we expanded what the nursing students did today, and we also said we had health information. So you got your screening, and then they had a table where they went over blood pressure and the heart and pre-diabetes and sugar's effects on body. It was very popular. So people would get screened, then they would come to the table and get more instruction. Then we had a table with Bianca as our lifestyle, coach for our lifestyle program, that pre-diabetes program. So if someone's blood glucose was elevated, the nurses were like, oh, we can help with that. Come on, be sure you stop by this table. And actually she had 3 people sign up as very interested, like pre-screened for our program. So there's a little bit more screening that needs to happen, but they were pre-screened, and we were able to have a sheet up to make sure they met the minimum eligibility for the program. So that was, I think, pretty great. Palomar Family Counseling had a table there. And then we also, we incorporate with that a workshop like on health and wellness. So today's was Sugar 101, be a sugar detective. And the workshops for the rest of the year, we're going to structure them around our lifestyle change program. So how can we bring people down the pipeline to get them ready to do something like that program? And we know with the data we've had for the area on the health challenges our residents face, a lot of them are lifestyle, illnesses. So lifestyle diseases. So if we can get that out, the same thing that helps with prevent diabetes is probably gonna also help with your blood pressure and help with, other, diseases like that. So we're gonna take pieces of that program, and bring it in. So that's the plan there. And what was exciting about this one is our partners, we've been doing it for a little bit, and I've been rolling it out for other people to get engaged. But this time, Palomar Family Counseling was there, and they actually had some of their grandparents raising grandchildren, grandparents come
Which is
with their
one of our
families.
grant
Team.
programs as well.
Oh, gotcha.
So it's one of our grantee programs. They came even with the grandchildren and got screened. So that was really nice. Michelle's place did a blast out through, I had asked them if they could blast it out to their Fallbrook residents, and they did. So that was, nice to start seeing, what I envisioned of everybody, working together and helping to promote these things. So we had 16 people attend the wellness workshop. So that was our highest attendance, which for something like that is pretty good. I mean, like 12 for an event like that is solid. Less than that, not bad. But so that was solid. We had about another 15 people get screened, and it was not a complete overlap. Some people came for the workshop. I'm good. I'm here for the workshop. I don't need to get screened. And then other people came and, did not attend the workshop. So I don't know what the actual number of people was, but for each of those events. So that was, and so some of the things we did, I think that made this one successful is we did put an ad in the paper. And we did have someone, because I can engage people, ask them how they heard about it, and we did have a couple people come in from the ad in the paper. I also did a larger than I normally do email blast out about the event to anyone who had been at the wellness center, and so I think that brought people in. And what was kind of interesting is we had quite a few men, which hasn't been the case in the past. And also there were several people where they come for COVID testing or vaccinations. And this was the first, non-COVID event they came to. So that was, good to see as well. So the other thing this morning I participated in was our meeting with Skinny Jeans as we developed the diabetes program. So one of the things we were tasked was to share our, I'm calling it a prevention network, but basically our referral, pathways and partners and how we plan, on reaching people.
Okay.
So that meeting, continues to be good as they kind of give us drips and drabbles of how to build the program.
Okay.
And are you familiar enough with who the Skinny Jeans people are, or should we explain?
I heard one presentation a while back, but it's not completely kicking. I know it's a national program.
So the DPP
Yeah.
program is a national program, CDC evidence-based. Skinny Jeans is a local entity that has really the highest level credentials for that program.
Okay.
And they received, in partnership with the county, grant funding.
So
To
sorry,
bring-
local as in Fallbrook, as in North
Local is
County?
in San Diego County.
San Diego County, okay.
So they received part of the grant to bring this program in a pilot format to 6 different partners. And we were selected to be one of those
Okay.
partners. So Skinny Jeans, who really is knowledgeable on this CDC program, is tasking 6 other partners with becoming experts so that we can run it ourselves and we don't necessarily have to have an outside partner.
So it's in a pilot drip phase right now, just getting up to speed and learning.
Correct.
Okay,
Right?
Yeah.
So Skinny Jeans is our teacher
gotcha.
and they're funded by the county to do this.
Okay,
So we're receiving all the training for this program for free, which is the important part. Training our staff on how to do it. The curriculum is technically free from the CDC, but it's almost impossible to figure it out on your own. You really do need someone to kind
Okay.
of walk you through the nuances. So that's what Teresa and Bianca have been doing with Skinny Jeans.
nice, okay.
So
Thanks for
that's
that.
the
No,
background,
that
because that happened, I think, right before you were fully back in and obviously before you were here.
Yeah.
So,
I caught at some meeting, I don't remember which one it was, but I remember hearing a little bit about it. Maybe it's a presentation at one of the chamber events, I'm not sure.
That's cool. We've been knowing this has been coming, so we've been putting it out there
Good.
little bit by little
Yeah.
bit. So next month, Bianca and I will attend a week training to become, lifestyle coaches. So we'll be trained to be a lifestyle coach, and really it'll be Bianca and I'll be the backup if, need be.
Okay,
Because the program, that the CDC program that we're doing is a year long in length. So we're looking for participants that will make that commitment. So screening them is really, important. It gets fantastic, results. The outcome from this program is really amazing. It's something like it's in the Catalyst report, in like 10 years out, 60% of people still don't have diabetes.
Right.
Like,
Awesome.
what? It's
powerful.
powerful.
Yeah, for sure.
It has much longer, much better health outcomes than just traditional disease management with metformin or something of that
Yeah,
sort.
yeah.
So the idea is if we can capture these folks before they're full, insulin dependent diabetic, hence it's called a lifestyle change program.
Right.
Or even if you are already deep into the illness, these lifestyle changes can really affect the overall course of the disease. The history on diabetes is the longer you have diabetes, the more detrimental it is to your overall function, right? Vision, circulation,
Yep.
heart, all of those long, difficult pieces. It's difficult to manage, and it's one of the biggest problems that most physicians will mention. Your frequent flyers are your diabetes folks,
Okay.
because there's so many systems it affects.
So getting to have it early. Big time
Don't
prevention
get
down
into
the
it
road.
all.
Get it all.
Yeah.
No, absolutely, but
Right.
then just
And
reducing the long
the
term.
likelihood increases with age, so,
Right.
we'll see once we get, our participants. We haven't really decided on if it's an evening or a afternoon type of, program, but we're, excited to be learning it.
And what's the capacity for us accepting people for this program?
Well, we want to have 20, we're
Okay.
looking for a group of 20. I would like to see if we could do a few more than 20, because some people aren't going to be able to keep the commitment.
Right.
And we want to have a solid trial.
Okay.
So I would like to see, 22, 24, with the expectation that some people will, drop out.
Okay,
So,
And because it is a year-long program, the idea is we could potentially do 1 to 2 cohorts a year. One of the programs we introduced to strategic planning is a group that also does this style program, but they would do it just for seniors. So the idea is if we allow this other partner to do it for seniors, our cohort could be adults or family age, depending, so that we could have a much broader reach.
right.
yeah.
So this is one of those programs that has deep impact, but for a narrow number.
Right.
Yeah, and for sure. So when it's 6 months, it's weekly meetings, and then for 6 months, it will either be twice a month or at least once a month. We'd probably go twice a month because you get better outcomes, with that little extra meeting. So it's lifestyle change. So it covers everything from how you sleep to what you're eating to how you're moving to mindfulness, stress reduction. Like it covers like a whole
Yeah.
gamut of things in treating that, diabetes, or pre-diabetes.
So we move 1 or 2 cohorts through 20 people at the end of this program. What happens? I mean, is it you're tested against your effectiveness of that and then you can expand it? Or is it funded to like a 20 per person type of year thing?
Well-
What's kind of the
Yeah,
next step
so,
look like?
so let's say we get through this first year with them, at which point Skinny Jeans can just say, all right, you're trained, and we can decide what
How
level
big?
we spin it
Okay,
up,
all right.
or what else, or how else it'll work. It is a reimbursable program through Medicare and Medi-Cal. We do not currently have that capability at the district.
Okay.
We also don't have some of the trained clinical staff, which is what Skinny Jeans is able to bring in.
Okay.
So after a year, when this program is over, we would have to essentially make a decision. Do we see value in this program? Do we want to contract with an entity like a Skinny Jeans or somebody else to run this program for us in some hybrid level?
Right,
Or do we suddenly want to be this other entity?
gotcha.
And we wanted to have proof of concept
Yeah.
through this first.
Sure, that makes sense.
This program was brought forward from our Catalyst report. They indicated that this was basically the best program to bring forward. They provided us background information that said, if you were to run this program, to staff it completely, to run it the way it's supposed to be, it's a $200,000 a year program.
Okay.
When you include all the staff and such. The board was not comfortable with making that level of financial commitment on an unknown project.
Sure.
So it was scrapped with a, what other options do we have? And then Skinny Jeans came back to us and said, hey, we got this grant. We love the wellness center. We love the infrastructure that you're building for a
Right.
community network. And they tapped us as one of their participants. So that's the
Check back.
background.
Check back in
Yeah.
a
And,
little less than a year.
Yeah,
All right.
and I think the truth is, in the end, it touches more than 20 people. If that person has a spouse, their spouse is impacted. If they have children, they're cooking different, moving different, bringing all this knowledge to their family. Then you go to work and you go, you look great. What are you doing? You know, and then you share a couple tips with that coworker who may go home and implement. So I think there's a lot bigger, you know, number of people affected. It's just really hard to gauge, you know, what that number is. But,
Okay.
I personally, I see this being something, if we look forward, what if we looked forward 10 years with some programs like this, and maybe we could reduce the incidence of diabetes in Fallbrook, and we could be below the national average. Like, to me, personally, that's what excites me about it. Like, over time, what can be done and what can happen, so, for a community, so.
Awesome. So the, all these programs and events that go on, I'm assuming we capture contact information, but where does it get? Is there any, say, I don't know if it's HIPAA, but is there any issues with us then becoming, you know, talking to them, maybe surveying them in the future? Nothing like this. So it's not.
no, we don't have to worry
Not
about
going
the
crazy,
HIPAA
obviously.
privacy for
Okay.
health information
Yeah.
until we start actually collecting that very specific data.
Right.
At which
Okay.
point, part of this training with Skinny Jeans is they have some software databases components that we may be able to plug all that
Mhm.
piece of the data in. Otherwise, it will probably just be, you know, very simple tools internally.
Okay.
Yeah. Again, we're not doing any of the billing, so we don't really have the same constraints on us because we're not responsible for
Yeah,
that.
yeah, I understand. Okay. At least from a name perspective and reaching back if we find ways that might be effective or gaining information from them and feedback from them, that's
Oh, yeah.
inbounds.
And it's part of the conversation is getting those participants to be our ambassadors, our cheerleaders. If they're able to, hey, at the start of this program, I looked like this, I felt like this, my health was this. I'm at the end of the program, I look like this, I feel like this, and my
Right.
health is this.
Yeah.
That's the testimonials are the best advertising we could have for the
Absolutely. Yeah,
program.
it's real and it's very effective.
Right.
For sure.
And we already know the physicians are motivated
Yeah.
for this program to
They
start.
don't have any, nothing in the offer. The other thing is we were hoping that the people who graduate from the program, maybe they would be not the full-blown lifestyle coach, but sort of like a mentor to the people coming,
Sure.
you know, the next group coming through, and can be encouragers and,
Right.
you know,
Yeah.
keep them, you
Share
know,
their story and
involved in the
help.
program
Sure.
too.
Okay.
And growing it, so.
Another final piece on Skinny Jeans, because they have various certifications, their partnerships are with a lot of educational and medical facilities. UCSD is a strong partner with them. They're doing a lot of research. So we have the opportunity to be connected to that research world, which allows us potentially other options.
Right. Good.
So there's a nice little, my academia
Yeah.
likes that.
Yeah,
Sounds
and
good.
being part of this cohort of all these organizations is really kind of nice because we'll be able to get more connected with community housing work that's in town. We're gonna, you know, the YMCA and, you know, some other organizations in the area. So I think that's another kind of positive of the way we're going about it.
Yeah, for sure.
So for learns.
Excellent.
So, and I feel bad that, I'll email you out the little report I do, but
No
the
worries.
next part of it is, kind of like the events, you know, by, you know, some different categories. So the total number of, attendance at the Wellness Center for December was 577. And so that was even up a little bit, like
Nice.
35 people from November. And so that number, it's not individuals, like we're not able to track like, you know, this person came to yoga 3 times, you know, like during the month. So these are actual like visits to the wellness center.
Gotcha.
And there's probably a few more than that because people come and, you know, just to check things out, but maybe didn't attend an event.
Okay. Okay.
So that was the number which, you know, for December, I thought was, you know, was
Pretty good
really
with the
good. We
holidays,
just
for sure.
continue, even with the
Yeah.
holidays, that's our highest
Yeah.
attendance
That's awesome.
month. So, and I'm trying to see, COVID testing went slightly up in December, just I think because of the holidays.
Yeah.
The other thing I kind of give a report on is some of the services that Mary Murphy from North County Fire, you know, with our joint agreement
Mhm.
does. So in November, Mary provided CPR training to a group of 20. She did, we've shared, like, got her on the system that we use for COVID testing, and she did 15 COVID tests. In December, she got COVID, so a lot of things got rescheduled. But she rescheduled 2 CPR classes and I'm not gonna say it right. Naloxone, you know. Naloxone class for January. And the CPR class was for Fallbrook High School for the junior ROTC program, and I think the other class was for the high school as well. So we're still continuing to build on those relationships. We've been chipping away, trying to get into the curriculum at the junior high and the area junior high and high school to provide the CPR training as a way to get families more involved and even parents interested in learning it. And then the students have that repetition through the years. So that's the next part of the report just gives you a list so you can see like how are we getting the word out to different organizations. So it kind of goes through like where we're putting, some of the places we're putting our printed flyers. Digitally, we provide a lot of the flyers, and I do make sure that the links in them are live links. So someone, if they received it digitally, can just click on it and register or get more information. So those are sent out, you know, as well as we do things with the chamber. We also send in our event dates to the Village News, like free press. It goes in the calendar section of the newspaper. So that's some of the ways that we get out more about our event. The next part that I've been reporting on is, you know, kind of like the press, like if there's been any articles. So there was 2 articles regarding the healthcare district in December. And of course, it focused around elections. So one article was Health District delays appointing new director, and Health District organizes selects non-Hispanic for open seat. Those were the 2. So Mike made a lot of press. No.
It's all you, buddy.
T-shirt.
I like the description.
Right.
It is what it is. At least it's right.
Yeah.
They are correct. So that was the press we received. And then you were asking about contact with people that comes to things. We're really great about getting emails. And so our email database continues to grow month over month. I'm always like in shock by how much new people we're touching because we're getting new emails every month.
And these
So-
are emails that are provided to us. We're not out there fishing them.
Mhm.
So we have a very low unsubscribe rate
Hmm.
and a fairly above average click or engagement rate.
Mhm.
So they're getting the email and then they're reading through it and clicking into those
And
links.
staying engaged, yeah.
Yeah, our click rate is 3% over the industry average. And our open rate is 15% over the national average, you know, similar type organizations.
Yeah.
So what we do, it's a lot of hard work to get these because we actually have old fashioned sign-in sheets and we type them in. That's one way. So for people who come, if it's something, as much as I can for our events, I encourage registration. One, it lets me know, is anybody coming? Well, we better get the word out a little harder.
Right.
One thing, and then the other thing it does is get that information. So, so what will happen a lot, like let's say mental health first aid, we have a, you know, It's free, it's 8 hours long. If you don't feel like it in the morning, we have, a higher than I would like no-show rate, even though we call to remind people, we send email reminders. But we have all those emails now, and we know they're interested in mental health. So, that's like one of the things that registration does is, we know when we have that person's information, that gets uploaded. The rest of them get hand typed in. If you're on the phone with someone, we're asking, do you want to be added and hear about our events? So, it's a lot of staff time goes into that and making sure it's clean, good data. So, like in January this month, we're playing a little bit of catch up from December, but we added 120 new emails this month. So far, we're not at the end of the month yet.
So you say you do have an online registration portal for certain events?
I use Eventbrite.
Okay,
And so what I do is I don't want Eventbrite platform getting the, I don't want to send people there. I want to send them to our website.
gotcha.
So what I do is I embed it on our website, either in the event itself on our calendar or on the programs page. So like the health screenings today, that's a reoccurring thing every month. I point everything to that page of our website. I'm in the process of trying to we have Google Analytics on our website, cannot find the login information. So it should be working. It looks like it's working. So right now I just worked with a website developer who had to talk to Streamline to get them to put code on it. And I registered with Google to try and claim it. If we can't, we'll get new analytics, but I would
It's
really like
painful.
to get all that data.
It's very
So,
painful.
yeah, and then we can see like, where do people enter our website? What are they interested in? We'll get a lot of great data once that's finished. So, but that's kind of the process and, with the registrations and embedding it. And Eventbrite is a free platform. And for right now, that's served us well.
Okay.
So, then the next part of what we reported on is social media. And I am very lucky to have a partner. Is she online?
No,
She on the Zoom?
She did,
She did? Did she get?
so let me.
Yeah, I'm here.
Okay.
There's
Hi,
Danny.
That's Danny, and she's my partner with, social media and a lot of our collateral and flyers. So, she works, for a North County, fire part-time and the rest of the time with us.
Yeah, so she's part of that shared staff
Mhm.
arrangement that we have through North County Fire.
Great.
Mhm.
Hello.
So
Hi.
take over.
Virtually. So hello, my name is Daniela. You go by Danny. And I'll just go ahead and start off unless there's any questions.
No, go ahead.
Okay. Can you guys not see my video? I don't know why.
No,
We see you.
We
You-
see you, but if you're sharing just your camera is showing, you're not sharing anything, right?
No.
Okay.
Okay, I just couldn't see myself, so I didn't know if that was working or not. So starting off, you'll see our social media metrics. They're across the board, you'll see that it's going to vary in upticks of where we're having improvement and where we're not doing so good. But consistently, we have been having more engagement and an audience growth in Instagram. And that's probably just because it's as the social media platforms kind of pivot from like TikTok, Facebook, Instagram, you're going to see there's a little bit more engagement from an overall population in Instagram. So December obviously was kind of like a wonky month for everyone because we were dealing with holidays and everything. But the post that had the most engagement and reach was our Christmas post. So I am hoping to implement a little bit more of a variety in our social media this coming year, more videos, more pictures of people, because we have a lot of graphics. We have a lot of events. So that's the reason why you will be seeing a lot of graphics. We're trying to announce a lot of these events, but hopefully with the new year and with my better knowledge of social media, I can diversify a little bit more what you are seeing on those platforms. Again, December was kind of a wonky month, so that's kind of all I have. If any of the new board members have any questions, comments, suggestions, I'm totally open to hearing it.
Oh, yeah, lots of questions, but not ready to go through that right now. I'd love to get some time and just kind of understand more about what's going on and just see some of the trends, and very interested in just understanding that. So we'll set up some time to just get a little bit of a download, so I don't take everybody's time tonight, but I'd love to see that.
Yeah, so what I would suggest you do before we meet and talk, just kind of take a look at those metrics that we have. Again, you're gonna see that it's varied. There's no consistent pattern, and I don't know exactly what is driving that, but you will see that on Instagram, as long as we're maintaining engagement with our audience. And that means whenever somebody makes a comment, we like it. If somebody's asking a question, we try and be quick about responding to them. We will see a little bit more growth. So as long as we're consistent with that, and in particularly on Facebook, being a little bit more participating a little bit more in the different groups, like Friends of Fallbrook, Fallbrook Latinos, those kind of groups, I think we can probably bring up all of our metrics a little bit.
Rachel doing some reels.
Listen, I'm the only one here who probably does have a TikTok account besides Danny. Right? Right. See, Danny, I got all of them. I got them all.
It is
I have a quick question. I was just wondering, what's the strategy as far as getting more followers? Do you do any sort of like ad buying to try to get more likes or followers, or is it just all kind of like organic, people just kind of finding the social media pages on their own? Or I mean, if you kind of go into that, I'd appreciate it.
Yeah, so a good chunk of it is organic. Teresa does a little bit of ads with any of like our bigger district sponsored events, like Mental Health First Aid, I think is one that she did an ad for, and I think even the Wellness Wednesdays. But a lot of it is very organic, and we have seen a pretty good amount of growth on both platforms since I've started. But yeah, so that's the main way that we've been getting traction. I try to be really good about keeping up with social media trends. A lot of what you're seeing on TikTok just naturally translates into Instagram and Facebook, just because you can post a lot of things from TikTok into Instagram and Facebook. So I try to be mindful about the sounds that are getting very popular, and the looks of different graphics and things like that. So that's mostly what I'm doing on my end. And that's about it. I am taking a marketing class right now through Mira Costa. I'm doing marketing, social media for businesses and human relations in business. So I'm hoping to have a little bit more insight about growing trends and different softwares or programs that we can use to hopefully bring our metrics up a little bit more.
Yeah, I appreciate that. I just want to commend you. It seems like you're definitely motivated to learn more about social media and marketing, and you're definitely you know, spending your time wisely as far as getting better at your job and everything. So I appreciate that. Thank you.
That's a good update. Yeah, I'm interested in understanding some more about that for sure. From the emails that we capture in the demographics of our population, what percent of them do you think are actually using social media? Is it pretty much a full?
Well, our demographics are probably right now, a lot of our things are during the day. You know, our groups like Encore, Rally for Children, Angel Society isn't a younger group. So Facebook is, you know, I think there's a lot of, you know, our, you know, adult population, and there's a fair amount. And we will see people come in brand new to events from something that's been posted on Facebook. And that's kind of what we've been focused a lot on, is information. We do a post each month, grants in action. That's kind of, you know, health district, the other part of what the health district does. So we'll share out information, you know, that would be beneficial to the community, but a lot of it is about you know, what's happening at the King's Health and Wellness Center and getting people out to things and aware of what's happening there.
Okay, good.
I have another question. It's not really social media based, but just kind of on the whole marketing side. So like when we do all these things like the Wellness Wednesday and you get everybody out, is anybody like taking pictures of that and trying to get that sort of stuff in the newspaper and things like that? I think that would be probably a good opportunity to, you know, I don't know, market it based off of like, hey, look at the success, look at this event, looks like,
Yeah.
I mean, it seems like it's, we're starting to build more success on some of that stuff. It'd be nice to, you know, kind of use that, you know.
We
bring
are
more
taking
people in.
pictures and, you know, and have that. There's actually a little video that, you know, we did today. She was on, our campus, for the
Okay.
event. Yeah.
Sweet.
And that's-
And does that stuff get posted to like Friends of Fallbrook, or just like the social media page, or how does that all work?
It gets posted to, pretty much to, you know, like to our page, and then we'll share it out or do posts. Yeah.
Thank
to
you.
the other Facebook.
That is a really good point. When I was talking about engaging more with those groups, that's probably something that we're going to want to do in the future is after having an event and getting some good pictures, posting them up and thanking the community for attending. I think that can create a little bit more of like a personable relationship and maybe bring people in that are probably curious about these events that haven't been to them.
Yeah, for sure. No, I agree with that. And then you might get some of the people that attended the event, like commenting on it, and some of their friends maybe coming out next time or whatever, but yeah, it seems like we're starting to get some synergy over there and, you know, things starting to build. So, yeah, good opportunity for sure.
Good update, thanks.
Thank you.
So I think that's pretty much what's
Okay.
been the report that, you know, the different, you know, topics.
Very good.
And we'll have, that Teresa's full report in the minutes for the meeting, so.
Great.
And I'll send you a copy of it
Thank
as
you.
well.
Thank you.
I'll take it.
Actually, we'll
Thanks.
put it on the portal.
Oh, yes.
We'll put it in the
Going on the
portal.
portal.
Love the portal.
All right, thanks for that. Next topic, public engagement brainstorming. I'm not sure we're ready to do that at this point, but certainly want to do that. I want to put my thoughts together on how that might look and get some feedback from you from a historical perspective and,
Yeah.
you know, how to engage, who to engage and why to engage,
Yeah.
those kind of things and do a little work on that. But I do want to do that at probably the next meeting, have a little brainstorming around that and I want to learn from the past, not repeat the errors and, you know, see what we can do going forward from that perspective. But I'm very interested in it because it's an exciting part of it. Any other comments on that part or?
I would just kind of add to what I was saying about the newspaper, like I would try to get more events in the newspaper. I mean, I don't know, I've been in the newspaper myself, for getting like a $500 check for a softball team, so it's like they put,
They look for content.
pretty mundane things in the newspaper all the time. I think that
Gotta
we've
fill
done
it up.
stuff like advertising and paid them in the past, but I would imagine that a lot of that stuff can get in there and that kind of gets more of that sort of population back to more of our events and everything. But I'd agree with Mike. I mean, you know, the more we kind of get into it, the more ideas we'll come up with and, you know, kind of go from there. But
Fresh look and given the current trends.
Yeah.
For sure. All right. COVID-19 updates.
I don't think we really need to keep doing that.
I don't think so either. We'll remove that item unless something spikes, happens or changes.
Yeah, if something shows that really is relevant, I think we can bring that forward to any and all committees, board meetings, but we're not really involved in doing that as activities like we once were. Teresa did mention that she took some of the test kits out to the growers. I know that post was out. I got to
Yep.
see that post.
Yep.
And that's one of those relationship building
Right.
that it's
Good
helpful to have.
Yeah.
But it's not like we got a lot going on. There's not a lot of new education that we can put out about it. So
Okay,
we can take it off the agenda.
sounds good. I agree. That one's gone. Government update, national, state, San Diego County, live well updates. So live well. I don't have the history here, and again, I know there's been ebbs and flows in terms of the historical perspective on the board members in terms of what kind of engagement we need that drives our strategies potentially. So this one is again, one I want to kind of understand more before we take steps immediately forward. Obviously, getting local and understanding what's happening from a local level is important. State level, there's some potential engagement opportunities there that I know you're involved with, that I may be, kind of touching a little bit here and there with some other contacts, but I don't want to spend time on areas necessary that aren't going to have an impact. But we do need to pay attention to what is happening so we don't miss an opportunity that may come up. So I'm open to suggestions and ideas on, where we need to plug in and where we may need not to plug in or do it on a less frequent basis. So that's kind of where my head is right now, and I'm open to ideas and other topics around that, but
Yeah, no, I
it's
would.
part of it, but we gotta do it, but let's, put our effort where it's gonna really have an impact.
Absolutely, no, I mean, I would agree with that 100%, local things and things that are relevant to the discussion is, probably our purview.
Yes.
And stuff happening at the UN and, probably, not in our jurisdiction, so.
Be great local, that's what we're gonna do, be great local. Excellent. Board comments, future agenda items. I'm gonna spend time, and I'll work with you on this too, to kind of frame the next series of agendas. I wanna get a report, take a look at that, see how we can frame that. It may not need to change anything, that's fine. And I do want to spend some time learning more about, the social side of things and how those strategies are actually talked about. Is there check-in milestones? Do we do something at the beginning of the year to kind of frame it? All those types of things are part around building strategy. So I want to understand what those might be and take it from there. Any other comments from you?
I just want to thank Teresa for her report and Danny for the report as well. I thought it was definitely really informative, and it's nice to see again the momentum that's kind of building over there. And so appreciate the report, and thanks to staff, and looking forward to working with Mike in the committee, and engaging the public. So
Absolutely.
yeah, that's it for me.
Well, thank you. Good information. I'm excited about this. I really, if you can tell, I have a little passion around this, and I really like seeing how we can grow and expand our awareness, but also engagement and impact. So that's kind of what I'm going to be looking at too. So if there's no other topics, we will call the meeting done. Adjourned.
6:12. All right.
6:12. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Take care. Have a good night.